Just as a disclaimer, the members of the House are in between votes, so we apologize in advance if there's connectivity issues. I'm going to go ahead and get going. Good afternoon, everyone. I'm Congresswoman Maxine Dexter. Thank you all for being here today as we fight Trump's big, ugly betrayal bill in the House. Today, you are going to hear from Oregon's fiercest fighters, leaders who have been on the front lines of defending our state's values. At the end of the speaking program, we'll open it up for questions from the press. Members of the media are asked to use the raise hand function to ask a question, and my team will call on you. We'll do our very best to get to everyone. With that, I'm honored and pleased to hand it over to the Dean of the Oregon House's delegation, my mentor, Congresswoman Suzanne Bonamici.
Well, thank you, everyone, for being here today. And as Representative Dexter said, we are in between votes. I'm literally in a phone booth at the back of the floor, waiting to see what happens. And thank you for joining us on this really challenging days to talk about one of the worst pieces of policies I have ever seen as a policymaker. Over the past several weeks, we've heard from constituents. We had meetings in districts. We're getting calls by the minute from constituents who are overwhelmingly opposed to this. I call it the big, bad, ugly bill. Because it's going to have devastating consequences for Oregonians, especially for Oregonians, but for people across the country, taking health care and food assistance away from millions of people, cutting education funding, reversing the progress that we've made transitioning to clean energy. I just ran into a friend in Oregon over the weekend who is in the renewable energy business for his whole career, with practically tears in his eyes about how they're devastating this this industry and what that will cost in terms of jobs and future health and safety and our planet. And I know Representative Dexter will get more into the devastating consequences of the healthcare provisions in this bill, which actually got worse when it went to the Senate. Sorry, Senator, but it got worse when it went to the Senate. It was bad enough when it barely passed the House by one vote. They actually made it worse. And when I've been home talking with hospital leaders and clinics, and not just urban, but suburban and rural, the catastrophic was the word that I kept hearing. As someone who relied on food assistance in college, I used financial aid, grants, loans, work study. I know how devastating these SNAP cuts and higher education cuts will mean. Now's not the time to raise costs for families, working families, and taking SNAP away from a number of people is going to be really devastating for Oregonians. We still have too much hunger, but this Republican bill really does torch a lot of, as I mentioned, the clean energy jobs, good manufacturing jobs. Our air will be and water will be more polluted, and Americans will be poorer, hotter, and sicker. And that is not what we want or need for our constituents. And why are they doing this? It's ludicrous that we are here today. There's no reason to be doing this now. It's to appease the president who wants to sign this on the 4th of July. Well, I'll tell you what, we are fighting this. The Republicans didn't write a budget bill. They wrote a death sentence for kids, for jobs, and for working families. And the reason they're trying to justify this is that they can give tax breaks to billionaires, people who don't need them. So I'm a policymaker, a mom, and an education advocate. And I know that our country does better when we treat people with humanity, when we break down barriers, and when we open the doors of opportunity. This bill does nothing to make America great again. It's one of the most dangerous and mean and regressive bills I have ever seen. So we are here. We're not giving up. We did a big rally on the steps today, and we are hearing that they may not have the votes, but we're going to find out soon. I hope that's right, that people are hearing enough from their constituents in their offices and out on the streets that this is a bad bill. We need to do everything we can to stop it. So thank you all for helping to highlight the serious problems with this big bad bill that will have devastating consequences for Oregonians and Americans. And I'll turn it back over to my colleagues.
Thank you so much. Senator Merkley.
Hey, greetings, everyone. And instead of blowing up fireworks on the 4th of July, the Republicans are blowing up our government in all kinds of terrible ways. As the lead Democrat on the committee that deals, the budget committee deals with the BYRD rule process, BYRD rule process, we kicked a lot of bad stuff out of this bill, but a lot of bad stuff stayed in. And by kicking stuff out, I'm talking about the sale of public lands, the repeal of the tailpipe rule, the restriction on courts issuing injunctions. But think about all the other policy miscellaneous that's still in. Lower funding for the CFPB, the sale of Spectrum, the expanding offshore drilling and drilling in ANWRs, ending some of the more beneficial student loan repayment systems, and so forth. But the heart of this has always been healthcare and SNAP. The impact on Oregon is enormous. Expected to lose about 200,000 people off of healthcare over the course of the 10 years. And quite frankly, a lot of it's being done by wrapping the application process for people in massive amounts of red tape. Red tape is something that you should remove for people who are struggling. They're in the less affluent 20% of Americans, instead of making it more difficult. They are proceeding to reduce the amount of provider taxes that can help states fund Medicaid, and that will have a significant impact. That will leave a hole by about 2029 of about $800 million in our budget. They proceeded to ban the ability to use Medicaid at Planned Parenthood clinics for a year after the bill is signed. On SNAP, Oregon is in a category where they will probably face a 15% match for the SNAP funding, nutrition funding. The match is zero. It's always been federally funded. That'd be about $240 million a year when that kicks in about 2028, and including another $75 million in administrative costs that Oregon is expected to have to pick up in 2027. They proceeded to set up a system here that is going to have an enormous impact on rural America. We know that Cliff Bench's district has a highest rate of Medicaid participation at 42%, some almost 300,000, about 298,000 people in his district. And of course, the lack of funding then that would flow to healthcare clinics and to hospitals would really hurt our clinics and hospitals in rural areas as well. And at the same time of doing all of this damage to nutrition, all of this damage to healthcare, this is driving up debt. The Senate bill will produce a massive increase in debt of about $4.5 trillion over 10 years, about 35 to 40 trillion over current law over 30 years. So it's sum up, it's families lose, it's billionaires win. It's some 17 million Americans losing health care to fund tax breaks for billionaires. It's millions of children, estimated 3 to 4 million children going hungry to fund tax breaks for billionaires. Democrats have a different vision. It's families thrive, and billionaires, they pay their fair share. So we tried to kill this in the Senate. We came awfully close with a 50-50 vote. Many of my Republican colleagues voted for it, in part in fear of Trump promising campaigns against them. And we're always hoping the Republicans in the House have a lot more spine to stand up for the people of their district and set aside their fear of Donald Trump. And I know my House colleagues on this call, they're going to do everything they can to persuade their Republican colleagues to not take this bill as a Senate rule, hopefully kill it, but if they can't kill it, change it significantly so we get another shot at killing it in the Senate. So thank you to my House colleagues who undertook the battle before the bill came to the Senate. Senate undertook the battle. Now it's back to the House. This is not done. We still have a chance to kill this horrific bill that hurts families to help billionaires. That's the wrong vision for America. And let me pass this back to Maxine Dexter.
Thank you so much, Senator. Really appreciate you jumping on while en route back to Oregon. Once again, Congresswoman Maxine Dexter, I am a mother, a physician, and very proud to represent Oregon's 3rd Congressional District. And look, what the senator was just talking about is exactly right. We are turning our backs on the working class, on the people who need us most. I grew up working class. I know what it means to live paycheck to paycheck. And I know that this bill is not just ugly, it is a betrayal of working families everywhere. Across this country, people are struggling just to survive. And this bill will turn its back. The American government will turn its back on them just when they need us most. And instead of using our power to help people, Republicans are ripping away healthcare and food assistance to once again finance tax breaks for billionaires. Last night, we had an opportunity to offer amendments, as the senator spoke to try to make this bill better. Every single one that I offered was not moved forward, was not approved, including making sure that Medicaid cuts would not lead to the death of children, seniors, or people with disabilities. Next, food assistance cuts would not lead to children, seniors, or veterans going hungry. And third, clean energy incentive rollbacks would not bankrupt working families. I also had one to mandate that ICE agents clearly identify themselves and remove face coverings unless medically necessary. These amendments are simple. Don't take away healthcare from families. Don't let kids go hungry. Don't undercut the clean energy economy of Oregon. And don't terrorize with government officials the people who are just trying to make a new life in our country. Republicans blocked every single one. They hide behind buzzwords like fraud, waste, and abuse. But as a physician, I'll tell you the truth. There is no way that cutting this much Medicaid without kicking, there's no way to cut this much Medicaid without kicking working people off their insurance. And as was spoken to, there's red tape hurdles that people cannot maintain. They are cutting care. They are going to undermine our rural healthcare system, our nursing homes, and almost 200,000 Oregonians will lose their health insurance. Clinicians will be pushed to the brink. Emergency rooms will be overwhelmed, and every single Oregonian will feel the decline of healthcare quality. This is not about people who are undocumented or working people who are unable to make all the ends meet and jump through the hoops. It's about every single one of us, because the healthcare system is going to erode with this bill. We must kill this bill. We can't give up. And I'm so excited and honored to be here on the behalf of Oregonians with these amazing, fierce leaders. And with that, I'm going to pass it off to one of the fiercest of them all, Southwest Oregon's Congresswoman Val Hoyle.
Thank you so much, and I appreciate everybody being here today, especially with my colleagues who I have a great deal of respect for, and we will do everything we can to stop this bill. Right now, we're in yet another time where Republican colleagues from the Freedom Caucus who say that they came here to reduce the debt. This bill literally blows up the debt. The Senate bill is worse than the House. So we're putting trillions and trillions of dollars on a credit card for our kids to pay. We're lifting the debt ceiling. And if Biden had tried to lift the debt ceiling by trillions, what do you think everyone would say? But here we are. Now, they've been called to the White House and they're holding back. But at the end of the day, we know they will cave. Their issue is that this bill isn't cruel enough. So we have 11 out of Oregon's 33 rural hospitals that are on the brink of closing. We can't afford to lose our rural health care. We've got jobs in clean energy, jobs in tourism that are leaving. So people are going to be unemployed while we are shifting costs to the state. Now, my Republican colleagues say, well, we're not cutting Medicaid. We're just shifting it to the state. We're just shifting all these burdens to the state. Let me tell you, they are cutting Medicaid. They are cutting Medicare. They are making it more difficult for people to access services that they need. And fundamentally, we're going to vote no. We are not going to allow them to get away with their talking points, because as I said last night, my constituents can't eat your talking points, and the reality of this is going to come crashing down on all of us and really, really crush our economy. So we're here to fight. I am hoping that 4 Republicans find a backbone, and that's all we can hope for. But we can continue to speak up. We can continue to delay. We can continue to make sure Republicans have to face the truth. And what I say is that Oregonians, people across this country, need to speak up and speak out before it's too late. And with that, it is my great honor to hand this over to one of my dearest, closest friends, the governor of the great state of Oregon, Tina Kotek.
Thank you, Congresswoman Hoyle. It's really a pleasure to be here in that we are all together as Oregonians, and I want to thank the press for helping us raise awareness. This is a 5-alarm fire, and we're here to tell you that this is devastating for the state of Oregon. So let's remember, every single year, Oregonians pay their federal taxes, and those dollars come back to our state through vital services like healthcare and food assistance and other programs. That's how the system has worked for decades. That's how it should work. The Trump administration and Republicans in Congress have broken and will break and are breaking that system. The Senate version of the bill that's being in front of the House right now, we thought the House bill was bad. The Senate version is worse. Just the provider assessment cuts alone would result in more than $10 billion leaving Oregon and our hospitals and our doctors and our nurses over 10 years for the Oregon Health Plan, our Medicaid program. For SNAP, according to our preliminary analysis, if and when the bill is fully implemented, the Trump administration and congressional Republicans will have cut over $425 million per year from food assistance in our state. And Oregon doesn't have the money to backfill that loss. Right now, I have directed my state agencies to immediately evaluate the granular impacts of this budget bill to Oregonians. One thing is very clear to me, though. This budget takes our federal tax dollars and hands a giant tax break to billionaires at the expense of our children, our families, and our communities. The money that helps Oregonians see doctors or put dinner on the table for their family is now going into the pockets of those who will need it the least. Last month, I convened a rural healthcare and food security panel, as well as listened to people who count on these programs today to take care of their family members, and their message was really clear. Rural parts of Oregon will be hit the hardest because of these cuts. 1 in 3 Oregonians rely on the Oregon Health Plan. This includes 1 in 2 children. 1 out of every 2 kids in the state is on the Oregon Health Plan. 1 out of every 6 Oregonians relies on food assistance through SNAP to feed their families. Every dollar stripped from these services and it's going to be put towards the top 1% in our country. That is a moral failure. This budget was inked in greed and not human dignity. I'm going to use every tool I have to fight right now to kill this bill and fight for what Oregonians hold dear. But I'm not going to pretend that our state budget resources can backfill any of this. This is going to be difficult if this thing passes. We need to stop it now and have real conversations about what our country needs. And I want to thank our electeds in DC for doing everything they can to fight this. Thank you.
Thank you so much, Governor Kotek, for your leadership, and we absolutely are honored and grateful to have you here today. Next, the remarkably fierce Congresswoman Andrea Salinas. Thank you.
Well, thank you, Congresswoman Dexter. Good afternoon, everyone, and thank you to my colleagues for hosting this event today and really just shedding light on the cruelty of this Republican tax scam. Congressional Republicans are betraying the American people by forcing a bill through that will make Oregonians sicker, hungrier, and poorer. At a time when Americans are already struggling to make ends meet, this bill would sell out children, seniors, veterans, and families to give massive tax breaks to billionaires. I know we've heard this before, but it is worth repeating. And I know I speak for all my colleagues here when I say that our response to this bill is very simple. Hell no. These cuts would be some of the cruelest, most dramatic gutting of benefits ever passed in Congress, and we won't stand for it. Congressional Republicans are pushing cuts to Medicaid. And what this means in Oregon, 1.4 million people rely on the Oregon health plan. All of these people could be impacted, and up to almost 200,000 Oregonians could lose their health care entirely, including tens of thousands just in the 6th district. Across the country, 17 million Americans would lose their health care. At least when the bill was in the House, it was only 16 million. Now it moves to the Senate. Now it's 17 million who could lose their health care. These cuts would shutter rural hospitals and clinics like West Valley Hospital or Woodburn Pediatric Clinic, just in my district. I've been talking to these folks. They are worried. They're really, really concerned. They could force nursing homes and healthcare centers to close, leaving families with higher costs and fewer options for care. House Republicans' plan also takes away funding for SNAP, our nutrition, Meals on Wheels, taking food away, again, from children, seniors, and veterans. I recently joined Marion Polk Food Share and Meals on Wheels to pass out meals to beneficiaries. And I spoke with one woman who relies on this food to sustain her life. She was told by her healthcare provider that she was underweight a year ago, and if she didn't get nourishing food, she would die. Meals on Wheels is life-saving. SNAP serves 740,000 or 1 in 6 Oregonians each month, half of which are children's, seniors, and people with disabilities. These people are not statistics. They're our friends, neighbors, fellow citizens. Stripping them from accessing food isn't efficient. It isn't cutting waste, fraud, and abuse. It is abuse, and hunger is a policy choice. And while Republicans claim this bill cuts taxes, that's only true for the wealthiest Americans. If you are not a billionaire, you are being sent down the river. For Oregonians struggling to make ends meet, this bill will raise costs on everything from your energy bill to your prescription medications to your food costs. Not only does this bill raise costs, it is also a fiscal disaster, allowing an additional $5 trillion added to our national debt. So for a party that claims to care about cutting the debt, it is crystal clear Republicans care more about cutting health care and SNAP. But it does not have to be this way. Time and time again, I have tried to work on, and as my colleagues here have, tried to work on a bipartisan basis on legislation that would actually bring down costs and make life better for families. But congressional Republicans have rejected this time and time again, and instead are just hell-bent on ripping away healthcare and food assistance for millions, all to benefit wealthy people. I'm committed to doing everything I can to stop this cruel bill. I'll keep speaking out, introducing amendments, talking with my Republican colleagues to protect Oregonians. Sunlight is the best disinfectant. So the longer we delay this bill and the more time we have to let the American people know how harmful this legislation is, the greater the pressure will be to kill the bill. Thank you. And let's keep up this fight.
Thank you so much. Congresswoman Janelle Bynum, you are up next, please.
Thanks, Rep. Dexter. Thank you all for being here today. I'll just start off very plainly and say that I've said this over and over and over again. This bill is trash. T-R-A-S-H, trash. This bill will have devastating impacts for Oregonians. It will cause our rural hospitals to close. It will make healthcare more expensive and less accessible. It cuts SNAP, forcing seniors and kids to go hungry. It gives more funding to ICE to carry out their inhumane masked raids, and it raises costs. All of that, and it increased the deficit. Not the best deal for us. And to be honest, I'm not sure how anyone can defend voting for this bill. I voted against it last time, and it was an easy decision to vote against it again today. I am looking forward to that vote. I hope my Republican colleagues have some courage, but I will be voting no. We fought back against this bill by introducing hundreds of amendments, testifying for hours, and showing the American people what's really in this bill. And even though this bill may pass, I'll continue to fight. We have to push back against Donald Trump and Republicans who are making life harder for Oregonians. And I'm ready to take the fight to every committee room, every courtroom, and every newsroom to do it. Thank you.
Thank you so much. Treasurer Elizabeth Steiner.
Thank you so much. And I would echo the thanks to all of the members of our federal delegation here today and to Senator Wyden for fighting so hard to oppose this. I want to be really clear. I, too, am a physician. I'm the Oregon State Treasurer, and I know that the budget bill that they're calling a big, beautiful bill, I call a horrible, ugly bill, as do many of my colleagues, because it will have terrible consequences for families, businesses, our economy, and communities across Oregon. Let's be clear. Cuts to health funding and food programs in this bill will raise the cost of living and doing business in Oregon in every other state, especially in rural and frontier communities. These cuts will leave hundreds of thousands of children and adults in Oregon hungry and without health care. Recent data, in fact, estimate that more than 500 Oregonians each year will die just because of these cuts. These cuts will raise the cost of healthcare premiums, deductibles, and copays for everyone, including businesses who are already struggling to meet healthcare costs for their employees. It will push more Oregonians into financial instability, debt, and bankruptcy. It will force many hospitals and clinics to close, taking thousands of jobs with them. It will eliminate jobs, reduce productivity, and harm the Oregon economy. Let's be clear, too. People who are hungry or ill can't learn or work well. It will add, as my colleagues have said, trillions of dollars to the federal debt, which will raise interest rates further and choke credit that Oregon businesses need to expand, hire, and grow. For people who claim that they care about the strength of the American economy, I would note that as of today, the US dollar is at its weakest point since 1973. 1973, over 50 years. That is not tending to our economy, which they claim to be trying to help. And as the governor said quite clearly, and as I, as a former co-chair of the state's budget committee, know, it will blow a hole in our state budget and almost every other state budget that no state has the capacity to backfill. Medicaid works. Today, 97% of Oregonians have health coverage. More than 9 in 10 non-disabled Medicaid beneficiaries aged 18 to 65 already work, or they care for a family member, or they're in school. So this is not, let's be clear, this is not about waste, fraud, and abuse. This is about red tape. This is about preventing people from accessing healthcare that they desperately need and deserve, and that lets them be productive members of society. The stakes are high for everyone. A quote attributed to Mahatma Gandhi says that the true measure of any society can be found in how it treats its most vulnerable members. By that measure and virtually any other, the proponents of this bill are demonstrating that they don't give a damn about how they and our society are judged. I urge House members to vote no on this reckless bill, which transfers trillions of dollars to the wealthiest Americans and biggest corporations by making food and healthcare more expensive for working and middle-class families. Thank you.
Thank you so much for joining us and obviously for your knowledge and leadership at the state. We are going to move now to our community leaders, and our first speaker will be Christopher Coburn, Chief External Affairs Officer with Planned Parenthood Columbia-Willamette.
Thank you.
The floor is yours.
And thank you everyone for speaking today. Well, here we are again. Congressional Republicans and the Trump administration are trying to defund Planned Parenthood, putting nearly 200 health centers across 24 states at risk of closure and making it harder, if not impossible, to get an abortion, even in states where abortion is protected. Here in Oregon, our doors at Planned Parenthood Columbia-Willamette remain open, as they have for 60 years, because without us, tens of thousands of Oregonians would have nowhere to turn for care. There is no replacement for Planned Parenthood. Other providers simply cannot absorb the need. Most of what we do at Planned Parenthood is preventative care, life-saving cancer screenings, STI testing and treatment, and wellness exams. In Oregon, 70% of our patients rely on Medicaid, and in the last year, the 2 Planned Parenthood affiliates serving the state of Oregon provided care at over 100,000 patient visits. This bill, if passed, would have devastating consequences for people across the country and right here in Oregon, for people who rely on Planned Parenthood for life-saving care. At Planned Parenthood, we'll continue to advocate for our patients like we always have, and we are grateful for our champions in the Senate and the House, many of them on the call today, for fighting to protect the care that's vital to those who need it most.
Thank you so much, Christopher. Now I'm honored to introduce Lindsay Schulten, Executive Director at Oregon League of Conservation Voters. Lindsay, the floor is yours.
Thank you. I really appreciate the time today, and for all of our leaders who are here and fighting back and sharing the space here. There are dozens, about 70 harmful environmental and climate rollbacks in this really terrible, big, ugly bill. It's a giveaway to big oil and gas, a handout to billionaires, and really feels like a gut punch to the rest of us who worry about our energy bills going up. A gut punch to all of us who really do want healthy, resilient communities, which I think is actually everybody. And it just disregards that. It's a gut punch to future generations who are counting on a healthy environment and a healthy climate. It's going to raise utility costs right away. It's going to kill clean energy jobs. It's going to make our air and water dirtier. Simply put, I would just say it is the most anti-environment and anti-climate bill in history. We have to keep fighting back. We can't stop. We have to fight at the state level. And I'm so grateful for all the leaders who are in DC representing Oregon and who have not stopped fighting back. So we have to keep doing this. And I really appreciate all the leaders here.
Thank you so much, Lindsay. Next, we have Richard Botterill, nurse and Oregon Nursing Association Board of Directors member. Thanks for joining us.
Thank you. I'm an emergency room nurse. I serve on the board of directors of the Oregon Nurses Association, representing 24,000 nurses and allied health professionals across every corner of our state. I'm here today because the reconciliation bill that passed the U.S. Senate yesterday is a direct attack on the health and safety of all Oregonians. If this becomes law, it will strip health coverage from hundreds of thousands of our neighbors, destabilize our hospitals and clinics, causing some to close, increase costs for everyone, deepen our state's nursing shortage, and the already dangerous staffing crisis in our healthcare systems. In Oregon, Medicaid is the Oregon Health Plan. Nearly 1.5 million people, including half of all children in the state, depend on it to see a doctor, afford their prescriptions, and stay healthy. This bill would push more than 300,000 Oregonians off of Medicaid, including tens of thousands of working parents, seniors, and people with disabilities. It also ends enhanced subsidies under the Affordable Care Act, driving up premiums and pricing people out of the coverage they fought hard to get. When people lose health insurance, they delay care, they ration medications, and they show up at the emergency room sicker and more afraid. And when they do, nurses are the ones who care for them, often while understaffed, overworked, and burned out. This isn't just bad policy, it's cruel, it's calculated, and it's dangerous. It puts tax cuts of billionaires above the health and well-being of every Oregonian. People are going to die. And Cliff Bentz and every member of the U.S. House of Representatives must vote no. Thank you.
Thank you, Richard. Next, we have Dr. Brian Duty, President-elect of the Oregon Medical Association. Thanks for joining us, Brian. I think, Brian, sorry. Am I the only one who can't hear him? Okay. Still can't hear you. I'm so sorry. It doesn't look, there you are. There you are.
Can you hear me now?
Yep.
Yep. Okay. Well, I'm sorry about that. I tried to test speakers ahead of time. Anyway, well, I'll begin over again. So once again, my name is Brian Duty. I'm a urologist at OHSU and president-elect of the OMA. And normally I would say, good afternoon, but it's obviously, sadly, it's not. I'd like to thank all of our elected officials for, fighting for our patients, our colleagues, our neighbors. House Bill 1 isn't just a budget bill. It's really a threat to the health and financial stability of over 1 million Oregonians. And stripping coverage from vulnerable individuals, especially children, won't stop them from getting sick. As Richard already said, it will simply force them to seek care in the emergency department when they're far sicker and we have less ability to be able to care for them. This is not sustainable. It puts added pressure on the healthcare system and our workforce, which are already at the breaking point, and adds cost in the most inefficient and inhumane way possible. The ultimate result is really more suffering, higher costs, and a system that is less able to care for everyone. This bill solves nothing and risks everything. Thank you.
Thank you so much. Next, we have Melissa Unger, the Executive Director of SEIU 503. Melissa, thanks for joining.
Thank you, and thank you to all of our elected officials here today. I just want to focus, we represent over 70,000 workers across the state, along with, partnering with unions across the state. And this bill has working people don't want this bill. They don't support this bill, and they know it's going to impact their lives. This is a giveaway to billionaires and to, Trump's cronies, as far as I can tell. This is the worst idea. And I think right now, what we need to do is call on the folks we can impact. And in this moment, that's Congressman Benz, who can actually vote no to protect his district, to protect the people on Medicaid, to protect the people on SNAP, to protect the important environmental protections that his constituents support. This is not about being a Democrat. It's not about being a Republican. It's about really standing up for the people in our state and in this country, and the people who go to work every day. So this feels urgent because it is urgent. The impacts are real. Families will lose. And so that's why we're all here today, to just call on Congressman Benz and Congress to not vote this down. So thank you very much for your time.
Yeah, thank you so much, and appreciate the call to action. We are going to now open it up to questions. So members of the press, if you have questions, please use the raise hand function, and I am going to hand it off to my staff who will ably take care of this.
Absolutely. Up first, we have Alex from the Oregon Capitol Chronicle. Alex, you're welcome to ask your question.
Hi, thanks, y'all. Out of curiosity, has any elected on this call heard from or communicated directly with Cliff Bentz in the last 2 days?
Yeah, I have. So I spoke with Congressman Bentz yesterday. I served with Congressman Bentz in the House, and we had a very thoughtful and direct conversation. Here's what I understand about Congressman Bentz. Born and raised, multi-generation, Oregonian. The conversation I had with him was what this will mean for his district. And he had a lot of questions about this bill. So I urged him on behalf of his state to vote no, that we will all stand with him if he takes that vote. And that's why I posted in the subject line there, the statement out of the CEO from Grand Round Hospital in LeGrand. That will tell you what that means for his district. I know he's listening. I urge him to do the right thing. And we will continue on, from my office, provide him all the information he needs to understand the impacts for our state. Thank you.
Now we'll pass it over to Amelia from Oregon Public Broadcasting. Amelia, we will circle back to you. Ben from the Lookout, you can go ahead and ask your question.
Thanks. I was wondering on the estimate for 200,000 people losing Medicaid in Oregon, kind of a two-parter. One is, does that come from the Congressional Budget Office or some other outside source? And number two, what's kind of the rough criteria used to determine who would be in that group? Like what kind of circumstances, what would be a textbook example of the type of circumstances someone would be in to fit that criteria? Thanks.
I can start with that, and then others may want to chime in. A governor may well chime in, but I want to say this. I've been doing health policy in Oregon for the better part of 30 years. And in Oregon, we used to have it that Medicaid eligibility only lasted 6 months. And because we saw so much churn on and off Medicaid, because it was so hard for people to renew on time and to provide all the documentation, one of the things we changed in Oregon a long time ago was to increase it to 12-month eligibility. And what we saw were improved health outcomes, more stability in healthcare coverage, and more productivity for people and better learning for kids. So anything that does what this bill does and makes it harder for people to requalify for Medicaid, whether that's an adult for themselves or on behalf of their child, is going to cause significant churn in our system. And when there's churn, there's lost opportunity to help people be healthy, to control chronic diseases, and that results in poorer learning outcomes and less productivity on the job.
Yeah, thank you, Madam Treasurer. I would just, on the eligibility checks, I think government should work as good as it can for people to access the programs that they pay for with their tax dollars. We have provided administrative streamlining in the state of Oregon that now will be undone by this with the 6-month check-ins. Every time you have to do more paperwork, people are busy, things get in the way, they will not continue administratively to be on the program. And that is just a cruel way to lower the caseload. About 500,000 Oregonians will be subject to these 6-month check-ins. And then if we look at the work requirement piece, I think someone said 462,000 Oregonians on the Oregon Health Plan would be subject to the work requirements. So that additional red tape of having to prove you're working or doing community service is an extra administrative burden. We estimate between 100,000 and as many as 200,000 Oregonians could lose their Medicaid coverage due to all these extra compliance administrative burdens and red tape. And I just also want to add, it will cost upwards of $100 million between staffing changes, administrative changes, IT changes to just do the work requirements and the 6-month certification changes that are in that bill. Money we could be spending on other things when we are in a budget challenged environment here in the state of Oregon. So makes no sense across the board. People are going to lose coverage and it's administratively burdensome. It's red tape. They're adding red tape to the bureaucracy that we have taken out.
Now, Suzanne Bonamici here. I just want to add that when we hear some of our colleagues say, well, this isn't really a cut to Medicaid, we're just implementing these work requirements, that most people who are Medicaid recipients are actually working already without a work requirement. Also, a lot of Medicaid recipients are children, and we're certainly not expecting them to work. And as we heard from the governor and others, the paperwork requirements are really onerous, and states that have actually tried work requirements have found that it really does act as a barrier, and it does not work. It just means fewer people are losing coverage. That's true with the increase in frequency as well as the burden. One example, I believe Georgia did this, but also Arkansas, when they implemented work requirements, they lost 18,000 people losing coverage. So it's just not realistic. Most of the people on Medicaid who can work are already working, and it's offensive to imply that that they're not working because they're getting Medicaid so they don't have to work. Again, people who can work are already working. You certainly can't expect children to work, and you add the paperwork on top of it. This is not government efficiency. One of my colleagues said last night they need to doge this bill because it's adding inefficiencies that add costs as well as taking away benefits. So bad provisions in this bill that are I think leading to this delusion that it's actually going to help people when it's really going to hurt.
Thank you, Congresswoman. At this point, we'll go back to Amelia from OPB.
Hi, can you hear me now? Hello?
Yes.
Oh, great. Yes, for the representatives, when are you expecting to vote on the actual bill?
Honestly, I
I
think
can
that's
take
a
that too.
question to all of us. This is Maxine. We are in a holding pattern waiting. They had meetings, some of the Freedom Caucus and other folks had meetings with Donald Trump earlier today. They came back, we passed the last motion, but we are currently in a holding pattern, and I'll hand it off to the Congresswoman Bonamici, who I think had more to say.
Yeah, thanks, Amelia. There were a couple votes already today. One just a procedural vote that passed, but what's holding right now is they're doing this in such a rushed manner that they made a mistake and putting how they drafted the bill going forward. So they made mistakes in the language that would give them sort of flexibility to later consider the bill and take other steps. So they have that vote. It's been held open now for almost 2 hours. And then the next vote is the rule that allows the debate to move to the floor for final passage or not. What I'm hearing and what some of my colleagues are hearing is that they don't have the votes for the rule. And there are various reasons for this. I know that, the fiscal responsibility people do not want to add somewhere between $3 and $5 trillion to the debt deficit. We've been hearing estimates, definitely more than 3, but up to 5 trillion. We're hearing that. And then I really honestly believe that people are starting to listen to their constituents who are calling in, who are writing and raising these serious concerns. So we don't know what's going to happen. I heard from a couple of sources that, including a Republican, not from Oregon, but a Republican, who said, we don't have the votes for the rule. So one rumor is that if they can't pass the rule, they'll just carry it over until next week. There is no reason in the world why this has to happen on July. The president wants to sign it on July 4th. This is a consequential bill, one of the most consequential bills in congressional history, I would say. And particularly when the Senate just passed something and made changes and then rushed it over here, it's more than 800 pages long. And when the House passed the bill the first time, which we all voted against, everybody on this call, people were afterward, Republicans were saying, wait, we voted for that. We didn't know that part was in the bill. We didn't know that part was in the bill. So this is no way to make a policy that's this consequential. So hopefully we'll have enough Republicans who say, look, let's not do this. And let's not, a win for today would be to not do it today, so we can continue to have people reach out to their representatives to say when this comes back up, which we know it will at some point, but hopefully not today. You've got to vote no on this. It's going to be really harmful. So procedurally, we're just stuck right now because they don't seem to have the votes. If, of course, they change anything that came over from the Senate, the president still wouldn't be able to sign it on the 4th of July because the senators went back home. So maybe they'll try to do side deals. I don't know, but hopefully it's not enough, and they can just table this, and then people can keep up their advocacy, because the stories matter, the advocacy matters, the calls, the emails, it all matters. So keep it up, everybody. Thank you to all the advocates for encouraging that. It is really, really critical that all these representatives hear from their constituents.
And, this is what I alluded to before. You have the Freedom Caucus that's saying this is going to blow a hole in the deficit, which it will, even more than the bill that passed the House. But what they want is to take out some of the things that were added in the Senate. So if it goes back to the Senate, do you then keep the Senate Republican votes? And here's my feeling, because in the 3 years that I've been here, every single time that we have Republicans, other than Thomas Massey, in the House saying, we're going to stand up for our principles, they cave. They get brought over to the White House. They get threatened with a primary. They get told whatever deals in the back. And understand, something this consequential, we represent half the country. And they are not consulting Democrats at all whatsoever. So fundamentally, they're going to say, we're not cutting Medicaid. This is a good bill. We just need to move it. They want to move it by July 4th because this is a loyalty test to Donald Trump. This is not about the policy. So we're going to stay as long as we can. They may send us home and then bring the Senate back in. We're not sure. At this point, we're on hold to see if they can somehow sweeten the pot, or, I don't know, shine someone's shoes, watch their car so that they stop holding everything up. But I don't have hope that my colleagues in the Republican Party will find their backbone and remember the principles that they said that they would vote on.
Thank you, Congresswoman. Now we will head to Nathan from KLCC.
Hi, I wanted to ask a question about a concurrent piece of news that's coming out about Oregon and the Trump administration, which is the delays on title awards for school programs. Governor Kotek, your office, in a statement, called it, at worst, it is another threat to force our hand. Force Oregon's hand at what, and what are some of the impacts that you all could potentially see of these title award delays?
Well, thank you for the question. It's hundreds of millions of dollars that going to schools in Oregon. It's a number of things. I guess we should be thankful that certain parts of the Title I dollars that go to very low-income, underserved schools in our state are not on the list, but we're talking about educator development dollars, which helps our educators be better prepared to serve our students. We're talking about communities of English language learners. We're talking about rural communities. We're talking about very specific title dollars that supplement what we can do in the state. And again, I'm just going to say it again. Those are our tax dollars going over to DC that need to come back the way they've been coming back all these decades. It's unconscionable that they think they can play with title dollars for our schools right now. And they're sending a lot of fear through our school districts right now. And it's got to stop.
I'll add to that too, because I'm on the education committee. I started hearing from educators about it right away, and working with the ranking member, the top Democrat on the education committee, doing what we can to call attention to this so it can be halted. These title dollars, the governor was correct that the Department of Education has said they won't cut Title I, which is the additional dollars for schools with high populations of low-income students. They've also said they won't cut IDEA, the funds that help students with disabilities, help support that. But the rest of the titles funds, as the governor mentioned, we have professional development, we have funding for English language learners, and then the big sort of pot of Title IV-A grants, which are now under attack. The Title IV-A grants serve three different purposes. There's technology, school safety, and well-rounded education. And those are dollars that really help close the opportunity gaps for students in all of our public schools. So it's things like technology, as I said, after school programs, arts education, safety. There's just so much that is under attack right now. But I also we want to remind the administration that withholding funding that Congress has approved is illegal and unconstitutional. So this is an attack on public education. They continue to attack public education. It will be challenged in court. And I know Oregon's not the only state, but there will be others as well who are targeted with this. But I lead the Title IV-A appropriation. It has been bipartisan support. I helped pass the Every Student Succeeds Act that consolidated those grants because we understand the importance of that funding. So I'm going to do everything I can to fight that. We as members of Congress don't have standing to sue, but we will do everything we can to stop it. But again, it's against both the law, the Impoundment Act, and the Constitution to try to withdraw congressionally appropriated funding. So I'm going to fight this with everything I can. This is a really critical, these funding sources are really critical for the education that our public schools and students deserve.
I want to put a finer point on that as a mom of 4 kids ranging in ages from graduate school all the way down to high school. When you look at this administration's attack on education in general, whether it's an attack on Pell Grants, whether it's the attack on educational freedom, the attack on institutions and their endowments, our title programs, when you think about those attacks, and then you couple that with what we just went through with COVID and our kids being out of full-time school for several years, when you think about that, you think about the impact to our ability to produce scientists, to produce the next generation of medicines, to produce engineers and scientists that help prevent us from having wars and provide us with a national defense that is sufficient. When you think about all of those impacts, I don't understand why the president and the administration are playing with fire. They also put in place Linda McMahon, who didn't have a very clear understanding of civil rights law and civil rights history. All of these will have an impact. It will have an impact on science in our country, on our ability to stay competitive, and our ability to defend ourselves. That, to me, is enough for him to stop playing with education and actually put it first.
I think if I could, I would just add, I'm sorry, go ahead, Congresswoman Hoyle.
Thanks. There also, in addition to this, is a little piece that's buried in the bill, and I put an amendment forward to see if we could get it in that big ugly bill, if we could get it taken out. In order to pay for these tax cuts for the top 1%, the top 5%, right? They're doing it on the backs of working people. So they're taking money from whatever programs they can. Right now, and in the ONC counties and our rural counties, this really matters. Timber receipts get shared with the counties, and that goes towards public safety and infrastructure and schools. Well, they are removing the timber receipts sharing so that timber receipts will come directly back to the Treasury, will not go to our rural communities while they're cutting schools. So they're really cutting the legs out of everywhere in Oregon, but the places that are going to hurt the most are our rural communities.
I think if I could, the one other thing I would add is this. I mentioned earlier that people who aren't healthy can't learn or work. The reverse is also true. People who are not well educated can't be healthy, and they can't be productive members of our workforce. So and we know that a good education is the best path towards economic security. And economic security in and of itself is the leading cause of good or poor if you have insecurity health. So anything that harms our education system, especially any cuts that particularly target historically disadvantaged communities, are particularly dangerous for the health and economic prosperity of every state in the union, and that's certainly true of Oregon.
Thank you. And now we'll pass it over to Kira from OPB.
Hey there. I am wondering if the governor or treasurer could could talk a little bit about how the tax cuts will affect Oregon, and if there are some Oregonians or industries that could benefit from this legislation. Thanks.
I'll have to follow up with you. I know there was some analysis done during the legislative session on the potential impacts of the House version. And so I don't know if there's been an updated version for the Senate bill. Because at this point we are connected to the federal tax changes, there will be impacts on our budget. And so we will try to get you some follow-up information on that.
What I can also share from an individual, not from a business perspective, is that it disproportionately will benefit those at the highest echelons and negatively at the lowest. So it's the largest transfer of wealth ever in this country's history. The average American making less than $50,000 will pay $700 more in taxes, while they also may lose their Medicaid or their SNAP benefits or other things, while the wealthiest will, on an average, I think, be getting $400,000 for someone who is a billionaire. And above that, obviously, it's going to be higher.
It's also beneficial to the fossil fuel industry. I just want to add that because what they're doing in terms of reversing tax credits and support for the renewable energy industry is they're trying to boost the fossil fuel industry, which isn't just the cost. One of the things we've heard is how energy bills will go up because actually renewables are less expensive, but you also have to factor in the health impacts, as Dr. Dexter and others know, asthma and being exposed to dirty air, dirty waters, going to add additional costs as well. So, if somebody's going to benefit, it's the very wealthy and the fossil fuel industry, which is tragic.
I think we're already seeing some of the impacts. We heard yesterday that a wave energy company is closing its doors because of a loss of federal funding and a loss of potential tax credits, which are important for renewables. The other point I would make that is somewhat indirect but still relevant is that there have been changes lately in ACA subsidies for Oregonians, people across the country who got really important subsidies to help them afford health insurance on the marketplace, on the exchange. And that, again, will have a negative impact on the economic well-being of Oregonians. And when Oregonians aren't earning as much, then that obviously impacts our state revenues as well. So the level of interconnectedness of all of these actions cannot be overstated, right? All of these things work together to cause significant economic detriment to individuals, to communities, to the state's economy, to tax revenues for the state that allow us to fund critical services. And they are additive, if not synergistic, and make each other worse.
Thank you. We're coming up on time at this point, so we'll just go to one last question from Courtney at OPB.
Thanks. I guess I wanted to ask too, but we'll just do what we can. Oregon has been awarded several $100 million for environmental programs, both through the Inflation Reduction Act and the Green New Deal. And I'm wondering if anyone here, this bill that passed the Senate, that version claws back funds that are not yet obligated. And I am trying to get my head around what that means for the funds that have been promised. And if we have a sense of whether programs that are getting up and going are going to continue, or whether Oregon will have to change course on that.
So I'll just briefly say, first of all, the Green New Deal never passed, but the funding from the Inflation Reduction Act, there's other funding that we are working on. For example, there's a FEMA grant, for example, that I was able to help get for Columbia Memorial Hospital to build a vertical evacuation structure in the hospital, because that is the safest way to protect people from tsunami. And the administration is trying to withdraw that grant, but I'm fighting, doing everything I can. The problem is that FEMA is within the Department of Homeland Security, and they aren't really focused on FEMA right now. They're focused on this incredibly dangerous, harmful deportation agenda, but we're doing everything we can. And I've had regular phone calls with folks at FEMA to try to get that funding back. Once funding is obligated, it is illegal and unconstitutional for to be taken away. And with the Inflation Reduction Act, tax credits and other programs, the treasurer was right. There was a business that is already a marine energy business that's already noted that they won't be able to continue. So it's going to be bad for these rescissions are going to be really bad for our economy and for the pocketbook as well.
The only other thing that I'll add to that is if renewable energy projects financed through or with subsidies from the Inflation Reduction Act are not completed by 2027, the end of 2027, those subsidies will be pulled back. So if somebody's already building something and they're going to be done in 2028, they may lose all of that subsidy, which is absolutely tragic. So I'm hoping, and that feels absolutely illegal if they've broken ground with those promises. So hopefully we can look further at that too. So I think with that, we are over time. My colleagues and our leaders have been amazingly tolerant and gracious, and thank you all for being here. The one thing that I just want to elevate is you, the media, are 100% who we need right now, and thank you all for being here. The fourth branch of government, as most people will recognize, is an independent and free press, and there are attacks on you as much as on many of us. And so thank you for doing your work. Thank you for sticking this through, and Oregonians are lucky to have so many folks here. So appreciate your coverage, appreciate what you do. And with that, I think we're going to close out the press conference. Thank you all for joining us.
Thank you.